Good morning, good afternoon, good evening, everyone. Welcome to the 5th Annual Global Media Forum on Antimicrobial Resistance, or AMR as we call it, which is organized ahead of World AMR Awareness Week, or WAAW 2025. WAAW is observed globally from 18 to 24th November every year. This year's theme of WAAW is Act Now, Protect Our Present, Secure Our Future. You will find the link to WAAW 2025 in the chat box. Today is also World Pneumonia Day. Common pneumonia causing bacteria are also becoming resistant to antibiotics, increasing the risk of mortality by 50% in patients affected by these resistant strains. This session today is in two parts. The first part is the 5th Global Media Forum on AMR, which is a drumbeat session ahead of WAAW 2025, featuring a very high-level panel of AMR experts. This first part is organized by Global AMR Media Alliance, or GAMA as we call it. Thanks to WHO AMR experts Diriba Agagnehu, Mosisa, and Dr. Philip Matthew for their support and guidance all through. The second part will feature the second edition of Global AMR Media Awards 2025 and the inaugural India AMR Media Awards. This second part is together organized by the AMR Narrative, Global Network of People Living with HIV or GNP+, Global Network of Young People Living with HIV or Y Plus Global, YPeer Asia Pacific, React Asia Pacific, Asia Pacific Cities Alliance for Health and Development or APCAT, APCAT Media, National Coalition of People Living with HIV in India or NCPI Plus, Youth Lead Voices, Humana People to People India, Delhi Society for Promotion of Rational Use of Drugs or DSPRUD, India chapter of GAMA and CNS. Right to health is a fundamental human right, not merely a privilege for few, but reality on the ground is far removed from this. Whether it is infection prevention or control, right and timely diagnosis, right and timely treatment, care and support, billions of people struggle to access the services with human dignity and rights. Furthermore, misuse and overuse of medicines is propelling a global health crisis of AMR. This misuse or overuse of medicines is happening in several sectors like human health, animal health, and livestock, food and agriculture, and is even reaching our environment. AMR continues to rank among the top 10 global health threats and a serious threat to food security. Multi-sectoral response is warranted to prevent AMR. We need to save the medicines that protect us. Most importantly, we need to humanize AMR response at all levels. A person-centered, rights-based, and gender-transformative response is essential for health justice, where no one is left behind. Please see a slide on your screens. WHO Task Force of AMR survivors and so many more are very willing to speak up. My humble appeal to media is to please remember to take the perspectives, voices, and narratives of AMR survivors while reporting on this issue. Thankfully, the four biggest global agencies on human health, animal health, food and agriculture, and environment, that is the Food and Agriculture Organization of the UN or FAO, UN Environment Program or UNEP, World Health Organization or WHO, and World Organization on Animal Health or WOAH, have united as Quadripartite Joint Secretariat on AMR. A few quick housekeeping announcements before we begin. Participants, please keep yourself muted as the speakers present. You can type in your questions in the chat box. All relevant questions will be taken up after the speakers have presented. Please also mention the name of your organization. Also mention the name of the speaker to whom your question is directed. Without any further ado, I am honored to welcome Dr. Jean-Pierre Nyemazi, Director of the Quadripartite Joint Secretariat on AMR. Thanks, Dr. Nyemazi, for your global leadership on AMR. Let us listen to your opening address. Welcome, sir.
Thank you so much, Shobha. And again, my appreciation to you and the Global AMR Media Alliance. Of course, with as well our colleagues, Diliba, Philip, and the Quadripartite Awareness Group for preparing this important meeting. Dear colleagues, partners, and members of the media, welcome. On behalf of the Quadripartite Joint Secretariat on AMR, I'm honored to greet you at the 5th Annual Global Media Forum on Antimicrobial Resistance, organized by GAMA with support from FAO, UNEP, WHO, and WOAH, commonly known as the Quadripartite Organization. Let me start with some reality, because most of the time AMR doesn't sound as a real issue to many of us. So bacterial AMR already kills over 1 million people every year. To put that in the context, that's 2 lives lost every minute. Again, another context, in the next 90 minutes of this call, more than 180 people will die because of drug-resistant infections. It's a big number, and we have been losing this many people since I would say 1990. Every year losing these many people. And again, it's also not just humans. AMR threatens animal health, plants, food systems, economies, and the environment. Let's remember that AMR is fueled by overuse of antimicrobials, poor infection control, gaps in water and sanitation, biosecurity, and unsafe waste disposal. Since 2016, countries have worked hard. Over 90% of countries now have national multi-sectoral action plans. But here's the challenge. Only 22% are fully implementing the national action plans with monitoring and financing in place. So that's why world leaders stepped up last year in 2024 with another bold commitment. The UN Political Declaration on AMR that I hope you all have seen of 2024, it has been adopted in the anger of last year in 2024. They made some commitments, and those include 60% of countries must have fully funded and implement AMR plans, 6%. For us to reach that, the member states also committed to mobilize at least $100 million, including through the AMR Multi-Partner Trust Fund that we'll discuss in length, and other mechanisms. This is a powerful signal that the world understands the urgency and shared responsibility. However, technical solutions alone won't win this fight. We need shared responsibility, and that's where you come in, the media. You make the invisible visible. You turn awareness into action. Through your reporting, you shape behavior, you influence policy, and you hold us accountable. Together, governments, industries, academia, civil society, and media, we can preserve antimicrobials, as Shobha mentioned. We can protect our industries, we can protect our economies and ecosystems, and we can secure our healthier future. This forum is a proof that collaboration can drive impact and communication can drive the change. In the spirit of the 2025 World AMR Awareness Week, let's act now, protect our present, and secure our future. Thank you, and I look forward for a successful meeting. Back to you, Shobha.
Thank you very much, Dr. Nyemazi, for setting the stage. And yes, indeed, a grim reminder of the havoc caused by AMR, and also saying that shared responsibility is important and cooperation can drive impact. Thank you for those uplifting words. And while I now invite the next speaker, Rob Purdie, who is a member of WHO Task Force of AMR Survivors, please see his message on your screens. My appeal to media once again is to remember to reach out to Rob or other AMR survivors, including those in their regions, to humanize media reporting on AMR. Rob, over to you to amplify the writing on the wall. AMR is invisible, I am not.
Yeah, thank you very much. Can you hear me?
Yes, very clearly.
Perfect. So, I will tell you that it's extremely early here, but it's never too early to act now to protect our present and secure our future. And, AMR is an invisible disease, but the WHO was smart enough to recognize the value of stories, especially in partnership with the media. And that is a powerful tool that the WHO has created for everyone. And I'll tell you a little bit about my story, especially since today is Pneumonia Day, World Pneumonia Awareness Day. So my fungal disease that I contracted in 2012 as meningitis primarily presents as a pneumonia. And because of that, it is one of the reasons that multiple prescriptions of antibiotics are on average are prescribed to patients with my specific disease, which is called coccidioidomycosis. And one of the unique aspects of fungal infections as a key aspect of AMR is the unique One Health aspect that they present. So fungal AMR is very intertwined with the agricultural use of pesticides. So rather than emerging out of overprescription of antibiotics, which happens obviously on the bacterial side, it has to do with the use of pesticides to control fungus in agriculture. And that is an excellent example of One Health and a perspective that we as patients and task force members have the ability in working with you and the media to present to the public. And one of the best ways to humanize a difficult and often theoretical discussion of something like AMR is through the use of lived experiences. It's a great way to communicate and make relevant a very complicated topic. And those lived experiences are powerful tools when used and amplified through the media, especially when linked with the data that is being generated around AMR and tied to actionable items like those in the UNGA political declaration on AMR that was recently released in 2024. And to serve all those purposes, the WHO Task Force of AMR Survivors is here to work with you at a regional, national, or international level, because we want everyone to understand that while AMR is invisible, we as patients are not. And I would like to thank you all for joining us this morning, and thank you for your efforts. And I hope that you will consider reaching out to myself or another member of the task force as you prepare stories linking to World Antimicrobial Awareness Week. And I thank you for your time.
Thank you very much, Rob. And thank you for pointing out once again that qualitative data is so very important to supplement and give a soul to quantitative data. And that is why the lived experiences of people suffering from AMR or caring for AMR survivors is so very important. I now invite Ernst Kuipers, former Minister of Health, Welfare and Sports in Netherlands, who is a member of Global Leaders Group on AMR or GLG, to deliver the keynote address today. Sir, it is indeed an honor to have you with us today. Welcome and over to you.
Thank you very much, Shobha. And the honor is absolutely mutual, even more so after the presentation and the direct input from patient experience, which we just heard. So distinguished colleagues, partners, members of the media, ladies and gentlemen, It's a great pleasure and an honor to join you today at the 5th Annual Global Media Forum on Antimicrobial Resistance, organized by the Global AMR Media Alliance in collaboration with the Quadripartite organizations. Allow me first to commend GAMA and its partners for their continued commitment to strengthening media engagement on AMR. Over the 3 years, this forum has become a vital platform for dialogue, learning, and collaboration between journalists, policymakers, scientists, and civil society. Antimicrobial resistance remains one of the most serious and complex health and developmental challenges of our time. It threatens not only modern medicine, but also the very foundations of global health security, food safety, and sustainable development. Last year, at the 2024 United Nations General Assembly high-level meeting on AMR, world leaders came together to renew their commitments, and the resulting political declaration was ambitious and rightly so. But let us be clear, declarations and strategies only matter when they lead to measurable challenge. And our challenge now is to translate political commitment into practical, sustained action. One area that requires our immediate focus is the implementation of the national action plans. Nearly every country now has a plan, but only 11% of them have allocated the necessary funding for implementation. And the UNGA declaration set an ambitious but achievable target. By 2030, at least 60% of the countries should have a fully funded national action plan. To get there, we must accelerate investment, strengthen national coordination, and ensure that AMR is integrated into broader health and development financing. The AMR Multi-Partner Trust Fund has already shown what is possible when countries and partners work together. Through the AMR Multi-Partner Trust Fund, low and middle-income countries are building surveillance systems, strengthening laboratory capacity, improving infection prevention and control, and promoting responsible use of antimicrobials in human, animal, and plant health. These initiatives are not abstract. They save lives, they protect livelihoods, and they safeguard medicines we depend on. As we look ahead to the upcoming Partners Roundtable, it will be critical to maintain and expand this momentum. And this brings me to the central focus of today's forum, the role of the media. In many ways, AMR is a silent pandemic. It advances slowly, often unnoticed, until it is too late. And that is why effective communication is essential. Media professionals are not just messengers. They are multipliers of impact. You have the power to make the invisible visible, to connect the global policy agenda with local realities, and to explain complex science in human terms, such as, for instance, by the story we just heard by the previous speaker. And also to hold us, policymakers and institutions, accountable for the commitments that we make. This forum is a testament to the growing community of communicators determined to make AMR a mainstream public conversation. Colleagues, the task before us is clear. If we act decisively now, we can preserve the effectiveness of life-saving medicines for generations to come. If we delay, however, we risk losing the very tools that make modern healthcare possible. Let us therefore work together across governments, sectors, and societies to act now, protect our present, and secure our future. Let us continue to support the media in their essential role, informing, educating, and inspiring action. And let us ensure that by 2030, our collective efforts have transformed commitments into results for every country and every person. Thank you, and back to you, Shobha. Thank you very much.
Thank you, Ernst. Thanks for your encouraging remarks, for GAMA members for putting in their 2 bits to fight AMR. And yes, transforming political commitment into action on ground is so very important. AMR has to become mainstream public conversation, as you rightly remarked. Thank you very much. Now, this is a perfect segue to a very important and critical part of today's Global Media Forum on AMR. The global AMR response needs to be fully resourced, as Ernst also mentioned, in terms of human and financial resources, supplies of essential health commodities, as well as in terms of social support. I now invite Javier Yugueros-Marcos, head of the Antimicrobial Resistance and Veterinary Products Department, World Organization for Animal Health, to please moderate a very important session today on investing in multi-sectoral national action plans. Over to you, Javier.
Thank you very much, Shobha. I hope that everyone can hear me okay.
Yes.
Just checking.
Yes.
Okay, thank you very much. No, thank you very much for the introduction, and thank you, GAMA, for organizing this important event. And as humans, you might have noticed that we struggle when processing projections, probabilities, or future scenarios. So let me start by reminding some of the figures that my colleagues have already mentioned so that they are very clear for you. Today, our incapability to treat infections because antibiotics are no longer effective kills more than 1 million people every year, which is probably the same number as the road accidents do all over the world. Today, 1 out of 6 bacterial infections confirmed in the lab is resistant to antibiotics. Today, drug-resistant bacteria in food-producing animals are costing the global economy billions of dollars, putting our food security at risk. And today, and directly quoting latest report from WHO, resistance to life-saving medicines is critically high and rising, especially in resource-limited settings. If all these are not an alarm bell for all of us, what else do we need? The misuse and overuse of antimicrobials in healthcare, in agriculture, in households, everywhere, have impacts that resonate. And the role of the environment is not to be undermined, because it can create new pathways for humans, animals, plants to be exposed to superbugs. Preserving the efficacy of antimicrobials needs coordinated actions, as success in one sector alone will not be enough to shift the figures that I have just mentioned. The United Nations AMR Multi-Partner Trust Fund, or AMR MPTF, let's call it like that from now on, is a fantastic mechanism allowing countries to accomplish this, to collaborate across human, animal, plant, and environmental sectors, turning plans into actions. Today, you will hear real-world stories, challenges, and solutions. No abstract policy talking, but concrete examples of what is possible when we come together and act as one. So now it is my pleasure to give the floor to Dr. Emmanuel Kabali, AMR Project Coordinator for the Food and Agriculture Organization FAO, to share some insights on the path to funded national action plans and the role of the AMR MPTF. Dr. Kabali, the floor is yours.
Thank you very much, Javier, and I hope you can hear me clearly. Thank you. Before I speak about the MPTF as one pathway to funding, let me just underscore some of the points that the previous speakers have mentioned. Indeed, AMR is not just a health issue. It's a food security, environmental, economic, and developmental issue. The rise of superbugs is a complex and cross-cutting challenge that must be addressed through coordinated global effort, and crucially, through multi-sectoral engagement and action at the country level. Most countries have multi-sectoral national action plans to curb AMR. These plans are the backbone of national response, setting priorities, guiding cross-sectoral collaboration, and defining clear pathways to strengthen surveillance, stewardship, infection prevention, and responsible antimicrobial use and disposal across human, animal, and environmental sectors. NAPs translate the Global One Health vision into tangible national action. However, like has been previously said, despite this progress, only around 11% of those NAPs have dedicated funding to implement and act on them. And plans without funding remain paper promises. The gains made in policy development risk stalling without the means to act. Yet political will exists to devote more resources to AMR. The high-level political declaration, for instance, called on members to mobilize $100 million, as was spoken before, to capacitate at least 60% of countries to have achieved funded NAPs by 2030 through the AMR MPTF alongside other funding mechanisms. The gender commitments also arising from the fourth high-level ministerial conference in Saudi Arabia last year called for creation of a troika, that is, to have the former, the present, and the future conference presidencies with an explicit goal, and I quote, to convene major multilateral financial institutions, existing and new bilateral donors, and private philanthropy to contribute to the sustainable financing initiatives, including the AMR MPTF, to support adequate funding of multi-sectoral national action plan on a multi-annual basis. And therefore, I come to the MPTF. For this reason, a resource partner roundtable for replenishment of the AMR MPTF will be held at the 5th AMR Ministerial Conference to be held in Nigeria in June next year. And the Quadripartite organizations have joined forces with partners to make this a milestone pledging moment, uniting international communities behind a shared ambition to support low and middle income countries on the pathway to funded national action plans. The AMR MPTF has an important role to play in this. That is providing seed funding to kickstart implementation of NAPs, fostering multi-sectoral coordination and collaborative action, and offering technical expertise through our quadripartite competencies. 21 countries have or are benefiting from the AMR MPTF support, which enables concrete multi-sectoral advances while positioning countries to attract new sources of funding for AMR NAPs. Our reports and advocacy materials highlight many examples of real-life achievements made possible. And today, we are only able to have 2 of such stories. You will hear from colleagues on how the AMR MPTF support enabled governments to move from strategy to action in Zimbabwe and in Cambodia. These are stories of how global solidarity translates into local change. And I hand back to you, Javier, to introduce our 2 colleagues. Thank you very much.
Thank you very much, Emmanuel, for these insightful thoughts. And let me now give the floor to those who are going to tell us about experience and success stories from the AMR MPTF supported countries. It is my pleasure and an honor to introduce Dr. Tapfumanei Mashe, AMR project coordinator from WHO in Zimbabwe. Tapfumanei, please, the floor is yours.
Thank you so much for the invitation. It's an honor to come and showcase what MPTF, the project, have done to the country. So I'm just going to summarize. I think because of time, I would have said so many things that this grant has helped the country. I think it's now a known fact that AMR is a global problem, and Zimbabwe is not spared among countries that are also affected by AMR. But from our analysis as a country, we have picked a few things that we think are the drivers of antimicrobial resistance. And one of the things that we have picked is an appropriate use of antimicrobials in the healthcare, agriculture, and along these areas is also disposal of unused antimicrobials in wastewater. So these are some of the things that we have agreed as a country to say these are some of the drivers causing antimicrobial resistance or increasing antimicrobial resistance in the country. So because of MPTF, Zimbabwe is a beneficiary of this MPTF, and MPTF, it has helped the country to implement some mitigation measures. I'm going to share a few of those mitigation measures which we have implemented and which have already shown the results that AMR, yes, it's a burden, it's a big problem, but if we implement some of the activities which are even written in the political declaration, there are so many implementation activities written there, but we have picked a few with the funds that we have received. One of the activity that we have implemented as a country is to improve national AMR coordination structures. We now have a very strong team that works together, Minister of Agriculture, Minister of Health, and the Minister of Environment, working together every day to push the AMR agenda forward. Even the UN agencies are also working together. The quadripartite organizations are all putting heads together to mitigate antimicrobial resistance. And another thing that we have also done as a country, which is a key activity, apart from having this multi-sectoral team working together, is to strengthen surveillance where we are tracking antimicrobial resistance in the human health sector, in the animal sector, in the environment, in the food safety sectors. We have been tracking antimicrobial resistance in all these areas. Then another area that is also very key is quality of medicine. And as a country, we are also tracking falsified medicine, and we've already set up a surveillance where we can check the prevalence of falsified medicine circulating in the country. Now to reduce, and one of the key issues that has been raised last year during the UNGA was issue of vaccines, use of vaccines. We've even had publications coming through to say, if you implement some of these activities, include the vaccine, WASH, you can reduce or you can avert about 750,000 cases of, or 750,000 deaths through antimicrobial resistance. So as a country, we've implemented 2 strategies which are anchored on vaccine. We have also introduced the domestic production of BOVAC, which is Theileria vaccine, which reduces antimicrobial use in the animal sector. We have also tracked as a country. In 2019, we introduced typhoid conjugate vaccine because typhoid was one of the issues that was affecting the country. And the reasons why we introduced TCV, it was because of increase in antimicrobial resistance. And because of that, we introduced typhoid conjugate vaccine. So using this fund, we have been tracking the impact of that introduction. I'm happy to share that we have seen a reduction from 1,373 per 100,000 cases. This is incidence to about 341. So there's a great decrease in the number of cases that we've been recording before the introduction of typhoid conjugate vaccine and the after introduction of it. So we've seen a great improvement. And even in terms of antimicrobial resistance, we have seen that there's now a shift in the AMR genes between the isolate that we got before the introduction and what we are now getting. In terms of success, the MPTF funding is boosted our commitment to regular meetings, multi-stakeholder consultations, and we have also seen an improvement in the way we do things from day to day. Not speaking of challenges, I will mention a few of the challenges that we have faced. We still lack domestic funding, but without domestic funding, all these issues are going to be reversed. But what we appeal to stakeholders following this webinar is that we need to invest into these funding streams, and we've seen great improvements in how we have handled antimicrobial resistance in Zimbabwe. I thank you. Over to you.
Thank you very much, Dr. Mashe, for this very thorough description of your challenges, the success stories, and how you are working to collectively contain the spread of antimicrobial resistance. It is now my pleasure and as well an honor to invite to take the floor Mr. Makara Hack, who is an advisor on animal health for the Food and Agriculture Organization of the United Nations, FAO, in Cambodia. Mr. Hack, the floor is yours.
First, thank you very much for having me today. And it's a great privilege to share Cambodian experience in tackling AMR and how catalytic funding has transformed our national AMR fight in Cambodia situations. Please allow me to take you back to 2019. At that time, Cambodia had just launched its first-time antimicrobial resistant national action plan, or a majority of us call it multi-sectoral action plan for AMR. And we had the ambitions, but the resources were not very limited, or we can always say that almost no resource to implement this SAP AMR. And efforts at the time were very fragmented. Then later the AMR Multi-Year Partner Trust Fund came in, the first external funder to believe in our visions. With 1 million in seed funding, we were able to significant step, and that has changed Cambodian AMR work or situations from that time. First, based on our work under this AMR MPTF, we established a national multi-sectoral coordination body under the One Health approach, and we bring together human, animal, and also environment health sector. We convene technical committees to review policy regulation, something that has never been done in the past. So second, we focus on the capacity building for a national, a subnational, and also private sector on the AMR and also AMU in the country. So we develop a number of the information, education, and communication material such as video, poster, treatment guideline, training manual for animal health sector. So up to now, more than 200 provincial and district veterinarians across the country, and more than 1,000 village animal workers, which is the private sector, has been trained on the use of AMR treatment guideline in a safe way. So this is under the AMR MPTF support. The third, the strengthen our animal health laboratory, which is very important for AMR area, and also surveillance system. We actually introduced the Laboratory Information Management System, LIMS, to ensure that data meets international standards. And we invest in building the capacity of the academia laboratory and also fishery laboratory. So this academia and also fishery laboratory has been built through our animal health laboratory network. So we support the animal health lab, but the animal health lab continue supporting the capacity of academia and also a fishery laboratory, which is a very good start. So all of these progress steps were critical and allowing Cambodia to move from, let's call, isolated initiative to a nationally coordinated AMR mechanism. This is very important to highlight. And this progress and effort have unlocked new opportunities. We have 1 million, but based on this 1 million from AMR and PTF, we strengthen the capacity, and at the same time, we can secure another 34 million US dollar for One Health in AMR in the countries through the German Development Bank or KfW. And we can use this to scale up our previous effort and also sustain the activity as well. And I would like to highlight also Cambodia is one of the first round pandemic fund averted country. So FAO together with Asia Infrastructure Investment Bank and the World Bank and the implementing entity of this first round pandemic fund. And of course, there's a lot of support from Quadripartite partner when we develop this pandemic fund projects. So Cambodia now has formalized a governance structure we call Interministerial Coordination Committee for One Health, with a strong collaboration with Ministry of Health, Agriculture and Environment. So we endorsed recently the second phase of our so-called the AMR multi-sectoral action plan for the second phase 2025 to 2030, and we developed a national monitoring and evaluation framework which aligned to regional and also global initiative. So our effort has improved surveillance currently, policy alignment and stakeholder engagement across all the sectors. The government now, systematically organize World Antimicrobial Resistance Awareness Week and hold monthly AMR meeting under each ministries, agriculture, health, and also environment. So recently, under our support, is a part of the continuation of our support, the review on the legal aspect for the animal health sector is ongoing, and we are going to create additional legal binding document to strengthen and reinforce the AMU in our animal health sector. So, in conclusion, I would like to thanks to AMR and PTF for their support to make Cambodian today AMR combat the AMR situation in Cambodia. Without this 1 million from the first, we could not make today change. So thank you again, all the participants, and also again and again to AMR PTF project. Thank you.
Thank you very much, Mr. Hack, for emphasizing the value of this catalyzing fund and all the progress that the country has made in this regard. To conclude this session, and before entering into the question and answers, it is my pleasure and also an honor to introduce you to Dr. Gunilla Eklund from the European Commission's Directorate-General for Health and Food Safety, also known as DG SANTE. Dr. Eklund, the floor is yours.
Thank you so much, Javier, for that introduction, and a very good morning to everyone from Belgium and Brussels. It's a great pleasure for me to join so many partners committed to tackle AMR together here today, and for the opportunity to share the views and experiences from the European Commission. So, in the European Commission, we support and invest in the AMR MPTF because it ensures donor coordination, it avoids duplication and fragmentation, and it gives the beneficiary countries the flexibility to focus on their priorities and their needs. And it also strengthens the One Health response by aligning all the relevant sectors that have been mentioned by speakers before me here. And we have just heard two fine examples of how the fund really brings people together on the ground to address a shared problem. And this is how we see the MPTF. It is more than just a fund. It's a platform for partnership. And as such, we believe it's a smarter model for aid. It actually allows collective action to deliver more than isolated projects would have done by themselves. And in these times, I think we cannot emphasize enough the importance of pooling resources in the current climate of tight budgets. The MPTF is a tried and a trusted mechanism that is efficient and effective. It ensures that the investments align, as I said, with the country needs and the country's own priorities. When we look at the EU, we tackle AMR through the One Health approach. We invest in research and development for new treatments, new preventive tools, new vaccines, new diagnostics. We do recognize that the MPTF projects are tailor-made, as I said, to meet the country needs. We heard Zimbabwe mentioning the vaccines, for example, ensuring that the investments is well spent. So, to round off, I want to say that we all know that AMR is a global challenge that nobody can solve alone. And this is why the European Commission supports the AMR MPTF. And this is why we also invite other governments and private sector partners to join us to make a change together. And with that, I hand over to you, Javier. Thank you.
Thank you very much, Gunilla, for these insightful remarks from the donor perspective. And to everyone, we hope that this session has convinced you on how the international community can align and tackle this cross-cutting menace threatening to append not just life-saving medical advances in antimicrobials for humans and animals, but also place the planet in even greater peril. I really want to thank on behalf of everyone, our MPTF partners, the one who have been supporting this mechanism since inception in 2019, as well as all the countries implementing these cross-sectorial national action plans using this catalytic funding. As some of those have already mentioned, this is just the beginning. This is the beginning part. And then sustained investments are essential. And 2026 is the momentum to go further by enlarging and strengthening this catalyzing mechanism such as the MPTF, as well as by sustaining the action that many countries have already started to undertake. And with that, I give the floor back to Shobha. Thank you very much for your attention and looking forward to your questions. Thank you.
Thank you, Javier, and all the other speakers, Emmanuel Kabali of FAO, Dr. Mashe of WHO Zimbabwe, Gunilla, Eklund of the European Commission. And thank you for enlightening us about the Multi-Partner Trust Fund. We have a few questions for the speakers. And also, I think some speakers have answered the question in the chat box, but we would be having few of our audience on YouTube also. So it would be good if you could just tell the answers to everyone so that people who are not on Zoom but they are watching this program are able to listen to that. So Zavar Kedwai wants to know if all countries are contributing to the Multi-Partner Trust Fund as per their GDP and including rich nations. Giving more, are they giving more? Is there a way to hold countries accountable that they fund MPTF and also their national plans? I think this is open to all the speakers, particularly the session moderated by Javier.
I can maybe start by giving a first answer.
Yes.
Short answer is no, not all the countries are contributing to the MPTF, and this is something that we want to change because as proved by the numbers and the science, this is a global program. This is a global problem that is affecting all of us, so we need much more support than that. And then on the question of accountability, I'm a great believer of accountability, but accountability in, I would say, UN programs, it's a difficult or a sensitive issue to tackle or to talk about. But I would say that we all have a social responsibility here, and the accountability would be the end. We all have in the UN General Assembly Political Declaration, we have specific targets and specific things to deliver. And I think this is a very nice way of measuring how we are progressing towards the effective containment of AMR. And I would also like to call on the support of the media, because the media can be very powerful and helpful in making all of us accountable, not only at the governmental level, but at all the levels of the society, because in this, we all have a role to play. So that would be my part of this answer, and I do not know if anyone from the panelists would like to complete. Thank you. Over to you.
Okay. Yes, thank you. Would
Just
any
two
of the
brief points,
yes,
just two brief points, Javier.
Yes.
That there is an opportunity, as I mentioned, at the next ministerial conference in Nigeria, because there'll be a pledging roundtable. So everyone else is welcome. Every country is welcome to put to show commitment and put something down, anything at all. And the second point is we need to change the statistic. We have over 180 national action plans. Only 11% have budget dedicated. So again, like Javier was saying, we can take responsibility by having budgets created. Again, the amount is not the key. The key is the intention to have a national budget line on AMR. We'll change that statistic and we'll show that we are accountable and committed. Thank you.
Anyone else from the panel? There is a similar question from Effie Mfande, a journalist from Zambia. Effie says, given that about 11% of countries with national action plans for AMR have dedicated budgetary funding, Why is it that most of the countries have failed to incorporate NAP in their national budget? And what is being done to encourage them?
Again, maybe just to
Yes,
continue
please.
my point.
Yes.
Effie, that's a very good point. I consider the media the fourth estate. I think they are famously known by that. I think we need your help here because when you speak, things tend to happen. And I think that is one critical area we have missed. Most national action plans are technical documents, but how to pitch those to the people that matter, even when we have high-level commitments, is quite difficult. And I think the media will be very helpful in pitching this the right way so that those resources are dedicated and colleagues can add to that. But thank you for that question, Effie.
Would anybody else like to? Yes.
Thank you so much, Effie, for your question. Maybe I can share some experience. I think another approach that can be used through the media and us technical people is now to look for interventions that benefit both. Because you know where we still have a challenge that we are still talking of organisms, and we have not managed to really link organisms to the economy, to the people, to the production of things. And I'll give an example of the WOAH vaccine that we've produced as an intervention. Zimbabwe is an agricultural economy. We have more than 5 million cattle, and we lost 500,000 cattle because of general disease. Whilst we are addressing antimicrobial resistance, we are not just addressing antimicrobial resistance, we are also addressing the economy by providing a vaccine. So it's easy now for the government to take over that intervention because it's directly affecting the economy. So what we also need to lure the government to support antimicrobial resistance, we need also to look for interventions that directly has an impact in the economy and the production. So if we take it from that angle, it's very easy. For example, the WOAH vaccine, I've been posting links that even the government itself, even the president himself, his cattle, we've even injected the vaccine to his cattle. Why? Because this is an intervention. He's also a cattle farmer. He needs this vaccine. We are addressing antimicrobial resistance, but we are also addressing the economy of the country.
May I jump in?
Yes, please.
I would have a very quick comment on that. I think a funding situation might occur everywhere around the world in terms of dealing with AMR, which is not the case for Cambodia. But from our country perspective, may be different from others. So when we want to get the government funding to one things, I think we start thinking about the institutionalizations of those. For example, now Cambodia establishing a so-called One Health Interministerial Coordination Committee. So this is just committee and it's not yet institutionalized in one of the government structure. So just committee. So there's no government allocation of the budget for this committee. And AMR Technical Working Group is one of the 3 technical working group, zoonotic disease and food safety, under this recently established One Health Interministerial Coordination Committee. So the aim at having the sustainable funding from the government is to making sure that this One Health IMCC in Cambodia institutionalized in the future so that the government will allocate a budget annually so that AMR as a part of this IMCC could also benefit from this institutionalization process. Thank you.
Thank you very much. Anyone else wants to add to that?
Maybe just one point before I go. So
Yes.
I think one area which I still speak to that area, remember I even showed the case of typhoid. So I think every rain season we're recording more than 20,000 cases of typhoid. But because we introduced TCV, in all the typhoid cases, because typhoid is part of our public health disease, all the people are not supposed to pay for treatment. So the burden of people getting typhoid belongs to the government itself. But because we said, no, yes, we're addressing antimicrobial resistance by introducing typhoid conjugate vaccine, but we are also addressing the healthcare of the people, and also reduction in terms of cost which the government was also incurring. There was a point in 2018 we used to use ciprofloxacin as the first-line drug. and it was not working because of resistance. We then moved from cipro to azithromycin, which was even more expensive. So that burden of the cost was incurred by the government itself. So then he said, let's introduce TCV, which is going to reduce the amount of money the government is going to spend, and also the mortality and the morbidity of the people. So my point is to say, journalists, they can help us to pick some of these interventions at high level because they have a direct impact to the economy and to the population.
Thank you. Thank you very much. There is a question for Dr. Nyemazi from Rashmi Kumar. It is important to address what you have said today. Can you please share how quadripartite agencies are programming together to address AMR along with within their organizations?
Thank you, Shobha, and thank you for colleagues. I had responded in the chat.
Yes,
So
but we would like to...
it's a great question. And
yes, thank you.
So the quadripartite organization, it's great that we know who they are. And the four organizations are not working alone, just to clarify that first. And we are also reaching out to the other international organizations and of course, other categories of organizations, civil society, private sector, philanthropy, and the others. Now, we have a collaboration framework, a strategic collaboration framework that basically entails all the key priorities that we all across sectors we wanted to collaborate on and that guide our work. And we have our action plans that we implement every year. We have many joint initiatives. And I pointed colleagues to our website and the last year report, annual report, where you'll find more illustrative examples of how we collaborate. One way is this: we support the member states in all areas, advocacy, awareness raising, but as well we hold technical expertise and we offer ourselves to support countries. We provide guidance, standards, especially across sectors. And we still respect as well the specific mandate of each organization among the quadripartite organizations. So we have areas where we collaborate jointly, joint initiatives, but we still as well manage in the way that each specific organizations, following its own mandate and their constituencies, they still conduct AMR response in their own specific sectors. So we appreciate to be asked such questions, and please go to our website, look at our reports, and reach out. I'll put our email address in this chat, and then you can also write to us with follow-up questions. Thanks, Shobha.
Yeah, thank you. Thank you very much. Dr. Naren Saini says funding is always a challenge. What are the parameters to say that it is adequate? Any of the speakers?
I can start.
Yes,
and
please.
I'll be as simplistic as possible, and then I see Javier might come in.
Yes.
When we start seeing results, tangible results, like Mashe was talking about, we are talking about lives being lost. I think in the introduction, our director, JP, clearly said, by the end of this webinar, almost 100 people would have died of AMR. That is the measure that we have. But there are other indicators, for instance, if budgets and farmers' use of antimicrobials, for instance, start reducing, and the money actually starts translating into higher incomes in their households, those are the actual measures that we need. We need to have impact, first, to reduce the number of lives, but second, to actually change livelihood, reduce hunger, ensure that there's adequate food on the table. I think those are the critical indicators in a nutshell and in a very simplistic way. Thank you.
Thank you. Anybody else from the speaker's side, would you please like to comment?
No, I think Emmanuel just gave the answer. It's the achievement of results. It's what it's showing you that the funding is adequate. And I would just add that the beauty of starting with a catalyzing mechanism that the MPTF, such as the MPTF, enable all of us to see that to check cost effectiveness, because 1 million for 1 year, 1 year and a half for such a global multisectorial problem is not much. And you have also seen that you can get results. So this is also another beauty of this mechanism. It's enabling you to see what is adequate and not overspend on something that might be very useful for other problems that the countries could have. So over.
Okay, thank you. Thank you. Now there are questions about media engagement. Faith Karuki wants to know, as we continue to advance the global AMR agenda, how can we ensure that media and strategic communication professionals are meaningfully included in global, regional and national AMR dialogues, not just as information disseminators, but as partners in awareness, education and advocacy? Their inclusion would help align communication efforts with policy priorities, enabling them to amplify these priorities and translate complex scientific and policy discussions into stories that inspire public understanding and action. There is a similar question from Daniel Besengula, who wants to know what are the opportunities for partnership between media communication practitioners and researchers to further the role of storytelling in fostering behavior change. How possible is it to have media in the room during the formulation of country, continental, and global policies around AMR? Because most often media is brought in at later stages when all decision strategies have been made, some of which lack the critical element of communication and engagement. I'm sure all panelists would like to respond to this question.
I can maybe start with
Yes.
some sort of an apology, because if the question is posed in that way, that means that we have not done our work properly, because we always want to engage with media, and we always want to work with you. And if your perception is that we are only calling you to disseminate information when everything is already cooked and done, then it means that we have not done our work properly in engaging you before, while we are, if I continue with this analogy, in the kitchen, preparing and working with the people in the field, with the scientists, with the medical doctors, with the farmers, with the veterinarians, etc., to really, as you said, transform all this information into meaningful stories. So I really take that as an action point for us on how to improve the way we engage with you, the way we communicate with you, so that you are not coming really when things are already down the stream, but before, so that we can work together and not just be part of the final stages of communication and dissemination. So thank you very much for the question and making us realize that we have to improve ourselves. Thank you.
Thank you. Thank you, Javier. Any more comments from other speakers, please?
Yeah, if I may, this is Rob
Yes.
Purdie.
Yes, please.
So I think media, I think that question is a very good question, but I would say that that is not representative of the power of media, in the sense that if you are waiting to be invited or the opportunity to be involved in these discussions, you're not using the full power of media. The biggest power of media is to generate the discussions that influence and establish these meetings and set the agenda for the meeting through public awareness and engagement, and translating stories and data into action. And I think that's a perfect example of what media can do at a regional, national, or other levels, is to create the narrative and shape the narrative ahead of the meeting.
Thank you, Rob.
And just to build on what Rob said, I believe media is very proactive. But when you look at AMR, because it's a very technical area, the risk of actually shaping a narrative in the wrong direction is much higher. And I think the ask here is that we need to create space and give ample capacity to the media to actually translate the message correctly. AMR is a very difficult concept to communicate, even among scientists. And it's very different from corporate communication. Communicating AMR is quite different. I think it's more related to behavioral communication. And I think it's not all bad or dumb and endow, we have made baby steps in the right direction. I know some countries have actually used some of the financing support we're talking about to have media awards, for instance, to have the best report from the media every year, because that helps curate the narrative, clarify the actual issue. And then where we really need to build on is actually on behavioral change. And in that question that is mentioned, is that to package communication for behavioral change, there's a lot we are learning ourselves as scientists, because, for instance, a recent publication was saying AMR or saying antibiotic resistance gives a different perception to the public. That is not science. We argue as scientists, but in terms of communication, we need to even learn how to simplify this further, so that when you tell a farmer that you're wasting your money using an antibiotic, when you can just clean your farm and keep your money, that is where we need media and communication expertise. So I think we have baby steps, but we have, and they say a journey of 1,000 miles starts with a first step. The first step is not sufficient. It's in the right direction. I think we need to make more space for media and then work together and plan ahead to have them have a role to play as technocrats in their own right. Yeah, thank you.
Thank you. Gunilla, would you like to add something to that?
Sorry, thank you, Shobha. No, I don't want to extend the discussion in the interest of time. I think everything has been said, but I could just say I echo previous speakers. Thank you.
Thank you. There is a request if all the speakers
can get... You have a hand from Makara, actually, and it's been up for
sorry. Yes, Makara, sorry. Sorry,
very quick comment from my side. We are not yet implementing the One Health media workshop. So in Cambodia, we plan to have a media workshop for One Health. So we gather around 20 media outlets, online, TV, and paper, newspaper, etc. So we see that there's some media report in a way that we technically seen that it's not properly reported. So I think we want to gather all the media and also technical people to be in one room. So we try to elaborate what is the technical terms, and also bringing them to visit our farmer field school, to visit our Rabies, avian influenza school forum, and others One Health activities. And then with this, we suggest they start formulating a specific One Health article, and then we consult all together and we see that what can be improved. So I hope with this plan, we can also improve the relation between the technical and also media outlet. And we see the importance of media in terms of amplifying the messages from our technical point of view. This is what we are being done in Cambodia. Thank you.
Okay. Thank you very much, Makara, and good work being done in Cambodia. I hope it's replicated in other countries also. And I think we have already exceeded the time for this first part of our session today. So we come to the close of the session, and my sincere gratitude and thanks to each one of the speakers for making it such a lively and empowering session. Thank you very much. Thanks to all of you.
Thank you.
And now we move on to the second Global AMR Media Awards ceremony and our inaugural first India AMR Media Awards ceremony, which we will begin in the next few seconds. Before we move to the second part of today's session, let us take a moment to read the message on your screens by Sue Charles, carer and daughter of an AMR survivor. And as you are reading, my appeal to media once again is to remember to reach out to Sue or other AMR survivors in your vicinity to humanize media reporting on AMR. Thank you for that. Welcome now to the second edition of Global Antimicrobial Resistance Media Awards 2025. Over 400 members of Global AMR Media Alliance or GAMA organized Global AMR Media Awards to recognize and encourage quality AMR solution journalism from the front lines, especially from high burden nations. Thanks for making it a great success. It gives me great pleasure to welcome my dear friend and inspiration, Annabel Manding, a renowned film and TV actress, show host, and celebrity from Germany. For years, she has supported people living with HIV and gender diverse communities. Despite being surrounded by a glamorous world, she remains a very down to earth and humble person at heart. She has been a member of the board of trustees of the Berliner ATF, that is Berlin AIDS Help, for over 20 years and has hosted the Gala Artists Against AIDS a few times in Berlin. Since 2024, she is also an honorary member of the Board of Trustees of the German AIDS Foundation. Despite her super busy schedule, Annabel has graciously consented to conduct today's Global AMR Media Awards ceremony. Annabel, we are deeply honored to recognize you as GAMA Ambassador to prevent AMR and help change lives. Congratulations for representing the cause of AMR, which is among the top 10 global health threats today. We hope that with your celebrity status, leadership, following, and audience reach, the message to prevent AMR and humanize AMR response would reach far and wide. A resounding welcome and a big thank you, Annabel, from all of us here who are committed to prevent AMR for helping support us today. Over to you.
Well, thank you so much for your kind words. My heart is touched. Thank you. Well, welcome, dear friends, to the second edition of Global AMR Media Award Ceremony 2025. Could you imagine a world without antimicrobial medicines that help cure diseases in human beings, animals, or plants? We are talking about antibiotics, antifungals, antivirals, and antiparasitics, or other medicines. Well, I can't. We need to save the medicines that protect us. We need to stop misuse and overuse of medicines that fuels antimicrobial resistance. Thanks to all the 323 journalists from 32 countries who were nominated for AMR reporting during May to October this year. Congratulations to everyone who reported on AMR and helped shine a light on underreported and less understood global health threat. This is another special award ceremony where women leaders in journalism and communications have impacted change. 2/3 of 27 awardees today are women. Congratulations to all of you. So without any further ado, let us hear from you, Shobha, again, once more. Please let us know, how did the award nominations go?
Thank you very much, Annabel. As co-chair of the judging panel, I am excited to share that 323 award nominations were received from 32 countries, as Annabel has mentioned, during the period of 15th May 2025 to 25th October 2025. Award entries came from each of the regions worldwide: Pan American, Europe, African, and Asia Pacific regions. 79% of them were from Southeast Asia and African region. Thanks to the 34 members from 14 countries of the panel of judges. All of them came from Asia Pacific and Africa, and over half of them were women. Kudos to them all. I would like to read their names and acknowledge each one of them. Yasmin Afshana of India, Madhu Babu of India, Abigail Tembe of Zimbabwe, Shiochin Tan of Malaysia, Ashok Ramsarup of South Africa, who co-chaired with me, Dr. Sangeeta Sharma of India, Pooja Mishra of India, Hari Surjadi of Indonesia, Dr. Mong Tho of Myanmar, Dr. Sugata Madhupadhyay of India, Subrat Mohanty of India, Bhakti Chavan of India, Dr. Kuldeep Singh Sajdeva of India, excuse me, Ramya Kanan of India, Kalpana Acharya of Nepal, Dr. Tara Singh Bam of Singapore, Nandita Venkatesan of India, Tariro Kudatsa of Zimbabwe, Dr. S.S. Lal of India, Alice Tembe of Eswatini, Anna Miti of Zimbabwe, Zanatul Bakia Keka of Bangladesh, Albertina Nyatsi of Eswatini, Okolo Chidera Godfrey of Nigeria, Nidafor Kishayana Nichang of Cameroon, Babe Goef David Ivan Patterson of Cameroon, Patricia Humara of Uganda, Louis Paul Ivan Kabaine of Cameroon, Ngwai Tangerini Marcel of Cameroon, Francis Casimir Banco of Nigeria, Annunciata Bukasenge of Rwanda, Joshua Okochukwu of Nigeria, Rita Vidyadana from Indonesia, and myself, Shobha Shukla of India. Thanks to all those who reported on the global health threat of AMR, whether they were award nominees or not. We salute each one of you given the critical importance of media engagement around AMR and One Health approach. Over to you, Annabelle.
Well, thank you so much, Shobha, and I'm very proud to see that so many people from my father's country are part of the judges, from Cameroon. Now, let me invite one of the most special persons today. We heard from Purdie and his heart-wrenching personal experience of AMR. AMR survivors and their loved ones have helped humanize the issue of AMR, which is often very medicalized. Giving human face to AMR helps us connect to people and impact change. We have Vanessa Carter amongst us, a powerful force for change and chairperson of WHO Task Force of AMR Survivors. She has founded and directs the AMR narrative. My appeal to the media, please do always consider listening to AMR survivors close to you when you report on AMR. Welcome, Vanessa. Thank you for joining us today. And thank you for making a difference.
Thank you so much, Annabelle. And you know what, I just want to say, wow, what an amazing, initiative to bring together media voices and so on, because, AMR is very real. We sometimes, like everybody said, we talk about it like an abstract problem, but it's very real for patients and for all of us. For me, I got into a car, I had a car accident, and several years later, I suddenly ended up with this resistant infection during a lot of surgeries for 3 years that I could not get rid of. I lost all hope at that point in time. And so to kind of also go back on what other people have said, AMR or antimicrobial resistance is one of the greatest public health challenges of our time. It's a top 10 global health threat. Unfortunately, most people don't know what it is and what they can do to play a role to mitigate it. So it threatens the effectiveness of medicines that we often take for granted, like antibiotics, and which we've all taken, and could lead to a future where simple infections become deadly. But we often talk about the future. If we rewind backwards to the past, before Sir Alexander Fleming actually discovered them, that's the kind of future that we're looking towards if these medicines fail. So the media plays a critical role in addressing this challenge. Through news stories, social media campaigns, and educational content, they can help raise awareness, explain the science, and reach audiences far beyond the walls of the hospitals and research labs. But awareness alone isn't enough. To truly make an impact, we must humanize, and this has come up from Rob very eloquently in terms of how we do that, in terms of including the voices of patients, carers, and those that are impacted by AMR. Their stories remind us that behind the statistics and the numbers and the science are actually real human beings, real people, families affected by resistant infections, patients navigating complex treatments, and communities grappling with uncertainty. By bringing patients into the conversation, the media transforms AMR from a distant, abstract problem into a tangible human issue. This approach not only educates the public, but also motivates action. And I just want to say it's not only from the patient perspective, but also from policymakers, because if there's a need to make a change, if that's amplified to the media, then we could probably see better policymaking as well. From better prescribing practices to stronger prevention measures and beyond. So let's move beyond numbers and headlines. Let's build understanding, empathy, to relate to the issue, and ultimately a stronger collective response. Let's ensure that the people at the heart of this crisis, the people that are most impacted, the patients, are featured, are heard, and their stories help to drive change. And so I just want to quickly go back to, yes, I'm very fortunate and I'm very proud to be the chair of the WHO Task Force of AMR survivors. And I'd just like to, again, encourage all the media. We are there, we 11 members, to reach out to us, and even beyond that, because we have members from Indonesia, we have members from India, the UK, Australia, Nigeria, Zimbabwe, USA. I'm from South Africa originally. And so that is there at your disposal, but also to think beyond that creatively and to say, well, how do we reach patients within our own communities? Because we know that that's not the only countries that we need to be looking at. And I think the last thing that I want to say is, communication, we know is not like, it's not going to be the ultimate silver bullet to change behavior, but it's certainly a good starting point. And in my patient journey, once I knew the basics, once I knew that AMR existed, I could take a more active approach in making sure that my patient outcome was successful.
Thank you so much, Vanessa, for your insights. And please let us know now who is going to take the first prize home in the Pan American region.
Of course, thank you so much. First prize, well done. Congratulations goes to Jonathan Lambert for his report published in NPR in the USA. So congratulations, Jonathan.
Congratulations, Jonathan Lambert, who reports for NPR in the USA. As Vanessa has stated, we have trouble with the internet connection sometimes. That's why I'm repeating this. Jonathan is a correspondent for NPR's Science Desk, where he covers global health. So Lambert has been covering science, health, and policy for nearly a decade. He was a staff writer at Science News and Grid. He's also written for The Atlantic, National Geographic, Quanta Magazine, and other outlets. Vanessa, tell us who won the second prize from the Americas, please.
Okay, fantastic. Thank you so much, Annabelle. And I'm already inspired seeing these winners. So the second prize in Pan American region goes to Andrew Jacobs of the New York Times in the USA. So congratulations, Andrew.
Congratulations, Andrew, who covers antimicrobial resistance for the Health and Science Desk. During nearly 3 decades at the New York Times, Jacobs has covered a variety of beats from the American South to the Zika outbreak in Brazil. Vanessa, time for us to know who won the third prize from the Americas.
Good stuff, good stuff. Okay, so the third prize in Pan American region goes to Jerry Klein of AKC for his article on domestic pets and AMR. So congratulations to Jerry Klein.
Yes, Jerry, for your article on AMR and breeding and domestic dogs and possible risk of transmission to humans. A reminder why One Health approach is a bedrock to address AMR. So Dr. Jerry Klein has been a veterinarian in the emergency room at Chicago's largest veterinary emergency and critical care hospital, treating thousands of cats and dogs when they are most in need. And he is also the chief veterinary officer and spokesperson of the American Kennel Club, or AKC. So thank you, Vanessa. And to all the media in the room and those listening to us online, again, please remember to speak to AMR survivors, listen to those who are experiencing AMR. Let us all humanize the narrative and AMR response. Moving forward, now it is time for Africa. I would like to invite Dr. Sangeeta Sharma, president of the Delhi Society for Promotion of Rational Use of Drugs and the only Indian on the WHO Steering Committee of Civil Society Commission on AMR. Welcome, our guest of honor, Dr. Sangeeta Sharma. After your opening remarks, please tell us who won the first prize in Africa.
Thank you, Annabelle and Honorable Chair, distinguished colleagues and dear friends, we are here to celebrate the winners of Global AMR Media Awards. And as we know, we are very, very deeply worried about this rising problem of AMR, because pipeline is running dry. And this situation has been created by misuse, overuse, by all sectors, by all stakeholders, and public being the most important stakeholder here, because largest use happens in the community. So media, where the role of media comes in, by your stories, you can tell us, we raise awareness, help public understand, make complex technical solution, complex solution problem like AMR, find a local solution. So I'm very, very privileged here today to give the honors to the winners of the second Global AMR Media Awards. Thank you. The first prize goes to, in the African region, goes to Miss Elizabeth Sitotombe of the Patriot Zimbabwe. Congratulations.
Congratulations, Elizabeth. Elizabeth is a Zimbabwean journalist with the Patriot newspaper, where she covers health, gender, and social justice issues. Tell us, Jangita, who won the second prize in Africa?
This prize goes to Miss Faith Kariuki of District Communications in Kenya.
Wow, congratulations, Faith. For your video story on AMR, Faith Karaoke is passionate about using storytelling to make public health issues accessible and impactful. Faith leads the AMR initiative at This Story Communications.
Congratulations, Faith.
Sangeeta, please let us know who got the third prize from the African continent.
We've got not one, but two winners here. This prize is being shared by Miss Amal Alam of YUM7 newspaper. This is in Arabic language media in Egypt, but this was translated for us in English. Miss Amal Alam.
Congratulations. And the second one
goes to Miss Davida Spain Solomon of Truth Media in Sierra Leone.
So congratulations, Amal of Egypt and Davida of Sierra Leone. Amal Alam is a journalist and head of health section in YUM7 newspaper in Arabic language, as Sangeeta has said, and she has been a journalist since 1990. Davida Spain Solomon is a Sierra Leonean journalist and public speaker passionate about health, gender, and social justice reporting. So now, in addition, we have the special mention prizes in the African region. So those are Babacar Sene of AgroPasteur, a French language media in Senegal, Hamu Madzedze of 365 Health Diaries in Zimbabwe, Audrey Kalawu of Zim Now in Zimbabwe, Munjaradzi, Blessing Doma of New Space Zim in Zimbabwe, and Rachel Abuja of Science Nigeria, as well as Oreo Luva Makole, a performance poet in Nigeria. Congratulations, everyone. So now, let us move from Africa to Europe, where I live. Let me invite Dr. Tara Zing Bam, Board Director of Asia Pacific Cities Alliance for Health and Development, or APCAT. Tara has devotedly worked for over 2 decades now with subnational governments and other local leaders to translate global goals into local actions and help save lives. Tara, I welcome you as a guest of honor. After your opening remarks, hello, please tell us who won the first prize from a region, from the region where I live in.
Thank you, Emmanuel. It's really great honor to be here with all of you. As earlier, all the speaker mentions, so AMR is a global challenge. What we need to do now is to address this. We need to work together at the global level, at the national level, and at the local levels. I think that is the solution with us. We are the problem creator, and we are the one to solve the problems. With this, I would like to really make an announcement for the first prize. The first prize in European region goes to Miss Kathy Kavanagh for her article published in Nature UK. Congratulations, Kathy.
Yes, congratulations. She's a science writer from Ireland, currently based in London, interning and writing for Nature News. Congratulations. Tara, now it's time for us to know who got the second prize in the European region.
Yeah, the second prize in European region goes to Johnny Manning for her article published in BBC UK. Congratulations, Johnny.
Congratulations also from my part to Johnny for the second prize. We come to the third prize. Who's going to receive that, Tara, please?
Again, the third prize in European region goes to Miss Nina Larsson for her article published in AFP News Agency, Switzerland. Congratulations, Nina.
Congratulations also from my part. Eugénie Larsson is a senior correspondent with Agence France Presse, AFP in Geneva. And she has reported for AFP for over 2 decades now from Geneva, Jerusalem, Islamabad, Stockholm, Paris, Washington, D.C., and New York, with a particular focus on global health, human rights, and international diplomacy. Well, thank you so much, Tara, for your valuable work. And congratulations for the Indonesian Ministry of Health Award conferred upon you. Did you hear that? Yes, because you're muted. Congratulations, Tara, and thank you again. We will move from Europe to the Asia-Pacific region. It is a great honor to invite Dr. Bassem Sayed, WHO Regional Advisor for AMR in the Southeast Asia region. Welcome, Bassem.
Thank you very much, Annabelle, and good morning, good afternoon, good evening, colleagues, and happy Media Award celebration. And I think this is a good way to start celebrating and commemorating the World Antimicrobial Awareness Week, and also to remind ourselves the importance of awareness about antimicrobial resistance, and also remind ourselves the threat that antimicrobial resistance has on public health, and also on people, and also on patients, on families, and on economies everywhere. And particularly in Southeast Asia and in Asia Pacific in particular, where we have several challenges in addition to health system challenges, and also there is a system challenge, there is health system challenges, and also in addition to economy challenges and also population challenges. So this adds layers of challenges when it comes to addressing antimicrobial resistance, in addition to other health challenges like climate change, pollutions, and also other conflicts, and also challenges related to other infectious diseases. So I'm really appreciating being on this call, and thank you very much for inviting me to be on the call. And also in WHO Regional Office for Southeast Asia, we work closely with member states in the Southeast Asia and the rest of the Asia Pacific to address the threat of antimicrobial resistance. So happy to be on this call. Over to you, Annabelle.
Thank you so much, Bassem. Now, let me invite our next guest of honor, Dr. Kamini Walia, who is one of the most senior AMR scientists and heads AMR at the prestigious Indian Council of Medical Research or ICMR. She's a pillar of support to Global AMR Media Alliance and CNS for over 2 decades now. Welcome, Kamini.
Hi, Annabelle. Thank you for the introductions, and thank you, GAMA, for inviting me to this very important event. As we all know, today we are here to celebrate the communication, the journalists and the communication efforts that have happened in last few years, and we are honoring them here. In fact, effective communication is the backbone of any public health containment effort. And unfortunately, for many years, while AMR continued to be with us, we did not have a lot of focus on communication. Communication is helpful not just in raising awareness, but it also leads to changing behavior, supporting policy and advocacy, and also building public trust. And it's unfortunate that for a long time we were not focusing on all these issues. I have worked in HIV in the past, and we all realize the importance of communication in HIV because of the stigma that was attached to the disease, how it was so helpful in raising awareness among the communities. But similar kind of effort was somehow not very visible as far as AMR containment is concerned. And I would like to congratulate this global alliance on media and communication, and how they have brought this whole spectrum of communication efforts in front of us, and we are now honoring all the journalists and the media persons who have made all the difference to bring out AMR stories, and also bring them to within the vision of the policymakers. So thank you for inviting me to this event. It is indeed a pleasure to be here.
Thank you so much, Kamini. Yes, their work is essential, and so we would like to award them, reward them. So please tell us who won the first prize in Asia and the Pacific now, Kamini.
So it is my pleasure to announce the first prize in Asia Pacific region, and it goes to Sautik Biswas for his media report, which was published in BBC. Congratulations, Sautik, and I've had the pleasure of working with him in the past.
Wonderful. Congratulations also from my part. We come fluently to the second award already. The second prize in Asia Pacific, Kamini. Who is going to take that home?
The second prize in the Asia Pacific goes to Miss Amanda Shepard, Managing Editor, the Medical Republic, and Deputy Editor, Health Services Daily, Australia. Congratulations, Miss Amanda.
Congratulations also. Amanda currently works as the Managing Editor at the Medical Republic as well. So please tell us, Kamini, who got the third prize in the Asia Pacific?
The third prize in the Asia Pacific region goes to Miss Sumi Sukanya Datta. She is a senior health journalist with India Today, India.
And congratulations from my part. She has over 17 years of experience in journalism. That's wonderful. Congrats, Sumi. But we also have two special mentions in the Asia Pacific region, which are Miss Ishita Roy of Health and Me, which is part of the Times of India group, and Miss Sujanya Padikal for her article published in The Hindu. So congratulations to you, and congratulations to all of you, and thank you so much, Kamini.
Thank you.
Kamini. So, dear viewers, on behalf of Global AMR Media Alliance, or GAMA, and as GAMA ambassador to prevent AMR and help save lives, I would like to confer the GAMA Changemakers Awards today to those who have truly made a difference in preventing drug resistance for thousands of people. Dear Florence, I would like to invite you now on behalf of Global Network of People Living with HIV, or GNP+. HIV communities have simplified HIV drug resistance, HIV goals and targets so that community-led responses coupled with efforts of government and other stakeholders can help end AIDS by 2030, ensuring all people with HIV know their status, that all of them are in life-saving antiretroviral treatment, and that all of them remain virally suppressed remains essential. So if people with HIV have viral load undetectable, then HIV is untransmittable. U equals U. That is why WHO says there is zero risk of any further HIV transmission when U equals U. U equals U means life-saving antiretroviral medicines are working. HIV virus is not resistant to the medicines. So, simple message, but fierce community-led struggles and HIV responses have ensured people with HIV to stay healthy and arrest the spread of infection. Congratulations, GNP Plus, for receiving the GAMA Changemakers Award 2025. Now it's your turn, Florence.
Thank you so much, Annabelle. Thank you to GAMA and to everyone on here for this prestigious award. We are excited to receive it, and I believe the media has and continues to be an ally to people living with HIV and definitely to people who are affected by AMR. You bring our lived experience as stories, you humanize our lives, you make data understandable to all of us. It is a pleasure to constantly work with you to break the myths and the misconceptions of HIV and to motivate all people living with HIV to benefit from this incredible progress in science. If we are on treatment, we are virally suppressed, we can't pass this virus on to someone else, but we can live healthy quality lives. Thank you so much.
Thank you to you. Thank you, Florence Anam. And I would like now to invite Sadhna Jadon, President of National Coalition of People Living with HIV in India, or NCPI+, for ensuring thousands of her network members across India remain virally suppressed. Hope and future. Hello, hope and future lies in the young.
Thank you for GAMA. मैं गामा को थैंक्स देना चाहूंगी कि मुझे समझने और बोलने का मौका दिया। मैं सीएनएस और सभी पैनल सदस्यों को एनसीपीआई को एएमआर की कैटेगरी में अवार्ड देने के लिए हृदय से धन्यवाद देना चाहूंगी। एचआईवी कम्युनिटी से एकजुट होकर एचआईवी ड्रग रेजिस्टेंस को रोकने में महत्वपूर्ण भूमिका निभाई। ये संभव हो पाया है एचआईवी कम्युनिटी की सक्रिय भागीदारी, सही समय पर जांच करवाना और सही समय पर उपचार शुरू करना। इन सभी प्रयासों के कारण दवा प्रतिरोध ड्रग रेजिस्टेंस नहीं हो पाया। यह कम्युनिटी की जागरूकता, अनुशासन और एकजुटता का परिणाम है। मैं यह संदेश देना चाहूंगी, जैसे एचआईवी के अलावा दूसरी बीमारी में भी सही समय पर जांच, सही समय पर इलाज और सही समय पर दवा ली जाए तो ड्रग रेजिस्टेंस को काफी हद तक रोका जा सकता है। इसमें कम्युनिटी की भागीदारी होना जरूरी है। थैंक्स, धन्यवाद।
Annabelle, can I quickly translate what she has said in English? She says she's very grateful to receive this award, and she actually gives the credit to the community for making this happen. And the same thing can apply to any other disease. If diagnosis is made at the right time, correct and early diagnosis, then the right treatment is given and enough care and support is given to all. So what the HIV community has taught can be replicated for other diseases as well. That is what she said. Thank you.
Thank you.
Thank you again. Wonderful words. And you're so right. Thank you. And
Thank you.
hope and future lies in the young, as we all know. So let me invite the Youth Voices leader, Pooja Mishra. She has ensured over 1,860 young people living with HIV remain virally suppressed and to not make the HI virus resistant to medicines. So thank you, Pooja, for leading from the front. GAMA Changemakers Award 2025 goes to Youth-Led Voices. Congratulations, NCPI+, for GAMA Changemakers Award 2025. There is no doubt that hundreds of thousands of homeless people and migrant workers must receive public health and social support in a rights-based manner. Access remains a major challenge for so many, even today. I think I was a bit fast, Shobha, right?
No, that's okay. That's fine.
Okay.
That's okay.
So I continue with the Humana people. To People India has bridged this critical gap, linking public health and social support services with most in need. So thank you also to Humana. Every homeless or migrant person you, Humana, have helped is one case averted of possible drug resistance, TB, reduced human suffering, and perhaps risk of untimely TB death. So thank you again. And welcome, Lisbeth Arup. Are you with us, Lisbeth?
Yes, I am with you. Thank you very much for this big honor. And as we have heard in this program, the stories means a lot. So I just want to tell a story from today itself. A few days back, we were granted an award from the Stop TB Partnership to start a new project in Delhi to reach out to 20,000 people, especially with information about drug-resistant TB. And today itself, we have 30 young women from the marginalized and vulnerable communities for training in our head office. 2 of them are survivors of drug-resistant TB, and they are now TASAs, what means TB-affected street activists going out to their communities and inform about that you could be cured, and we can work together about that. So thank you very much for this honor. We will continue to reach out as we have done to about TB for the last 10 years and in the HIV communities for the last 25 years. Thank you very much.
Thank you so much for your encouraging story. And thank you, Humana.
I have just one more thing to add, that
Please.
in the day-to-day life, we communicate a lot from people to people. But I would also like to take this opportunity to invite interested journalists to come out and visit our projects and talk to the people in the field who are doing this work in the day-to-day life. So most welcome.
Thank you for that invitation. Okay, Lisbeth, thanks. Thank you again for your precious work.
Thank you.
Now, I will invite Sumit Mitra, who has devoted decades in ensuring essential diagnostics reach the unreached, especially in the global south. He has upheld key principles of equity and health as a human right with courage and persistence, while striving upstream against the global north heavy current and ensure people who are left behind can receive best of molecular diagnostics at their doorsteps in the global south. So congratulations, Sumit, for a GAMA Changemakers Award 2025. Sumit, please.
Thank you very much, Vanessa.
That's Annabelle. I'm Annabelle.
Annabelle, yeah, I'm sorry. So yeah, 75% or more medical decisions are based on diagnostic tests, and diagnostics often get the least priority in the healthcare delivery. So our focus has been diagnostics. And as you rightly said, the key was to provide access to quality diagnostics in countries that are very limited in resources, including our own country. And very happy to see that post the pandemic, the awareness on diagnostics has greatly kind of increased. The communities are up and running, demanding diagnostics as a matter of right and not kind of looking at it as a privilege. So absolutely happy to be part of this great team. And thanks to GAMA for this invite and, taking up our case and the work that we've done. And very grateful for this opportunity to talk to all of you. Thank you very much.
Thank you so much for being here, Sumit, and congratulations.
Thank you.
Congratulations to all awardees today. It was an honor to guide you through this special award ceremony. Please keep up with your wonderful work. I wish you strength, endurance, and success with your projects. Take good care and goodbye.
Thank you very much, Annabelle. My heartfelt gratitude for hosting the Global AMR Media Awards 2025. I really am short of words to thank you enough. It is difficult to find persons like you in today's world who soar high in the sky but have their feet set on the ground. I'm proud to be your friend, and later on you can kill me for overshooting the time. Not now, but
like last year.
Like last year. Thank you.
I'm proud to be part of the team. Thank you so much for us. Enjoy that your work and what you do is incredible. It is incredible. Thank you.
Thank you. Thank you very much, Annabelle. Thank you. Friends, let us now move to the inaugural India AMR Media Awards this year. We thank WHO India's Dr. Anush Sharma for the encouragement which helped us collectively launch India AMR Media Alliance on 7th August 2025 in India Press Club in Delhi in a national media workshop on AMR organized by REACT Asia Pacific. Thanks, REACT. All members of Global AMR Media Alliance from India are part of India AMR Media Alliance. I thank each one of them. We received 106 entries from India and judging process remained the same as that of Global AMR Media Alliance. Thanks to the 34-member panel of judges for due diligence. It is a great honor and privilege to invite our dear friend and AIDS comrade and communications expert, Cedrian Martin. She has served UNAIDS for several years now in the Caribbean as well as in Asia and the Pacific regions. Welcome, Cedrian. Great moment for all of us to have you host India AMR Media Awards today. Over to you.
Thanks so much, Shobha. Wonderful. Thank you for inviting me. I'm pleased to join you from Bangkok. I'll start with a little bit of dark humor. What do HIV and antimicrobial resistance have in common? They both love it when we finish early. Treatment, funding, and attention. And it's been so wonderful to see the parallels that are being made across different public health issues, because we really do need to understand the fundamentals and have a comprehensive approach to multiple health and development challenges. So this has been inspiring. And also great to join this particular initiative that's incentivizing news media coverage of critical public health issues. It takes me back to the start of my career about 2 decades ago in the Caribbean as a journalist, when initiatives such like this were so instrumental in incentivizing me personally to write about a range of health and development issues. And it's also wonderful to recognize the excellence from reporters. You know, research is critical, research articles are important, journal articles are important, but that doesn't quite do the job of getting important issues on the agenda, top of mind as a policy priority. We do need the storytellers to ensure that they create a sense of urgency, that they give a human face to some of these issues, and they make it accessible, understandable, and simple for people to grasp and for people to be motivated to act. And so we are really, really pleased to hand over to Dr. Anuj Sharma. He's a technical focal point for AMR and infection prevention and control at WHO India. And we thank him for his guidance to the Global AMR Media Alliance, which led to the formation of the Indian chapter of the GAMA. So Dr. Sharma, we hand over to you to give your opening remarks.
Thank you, Cedrian. Honorable guests, colleagues, and distinguished journalists, on behalf of the WHO Country Office for India, it is my privilege to congratulate the Global AMR Media Alliance and the India Media Alliance on AMR for organizing the second Global AMR Media Awards and the first AMR Media Awards. Media has an important catalytic role in raising AMR awareness amongst the people. AMR stories, investigations, and clear reporting can turn complex science into public understanding and action, thereby saving lives. We salute the reporters, editors, and media houses whose courage and clarity shines a light on stewardship, surveillance, and the social drivers of AMR. We encourage you to keep telling the hard stories, keep demanding better policy on AMR, infection prevention, and access to quality care. AMR is everybody's business, and together, along with the courageous journalists and informed citizens, we can bend the curve on AMR. A reminder to everyone to go blue for AMR on 24th November, which is the Go Blue Day, the last day of the World AMR Awareness Week, and use social media to tell everyone why you are going blue for AMR. Thank you, and congratulations in advance to all the awardees. Thank you. Back to you, Cedrian.
Thank you so much. And now we're going to have our guest of honor, who has made India and the world proud, Mr. Sriram Natarajan. Let me tell you a bit about him. Just 2 weeks ago, he received the world's biggest TB prize, the prestigious Cochrane Prize in Manila, Philippines, from the UN-hosted Stop TB Partnership. Sriram is a serial entrepreneur, someone whose scientific innovations gifted the poorest nations of the Global South with the world's first rapid test for malaria a couple decades back. Without diagnostics that can be used by those on the margins, how can we ensure right treatment? Right diagnostics is the entry to right treatment and preventing antimicrobial resistance. And more recently, he successfully transformed RT-PCR diagnostics. We used to need highly sophisticated lab infrastructure, but he's made it possible to have truly point-of-care diagnostics, which needs no lab infrastructure. TrueNat is lab-independent RT-PCR, which is, listen to this, battery-operated and rechargeable with solar energy, completely decentralized, and deployable at real point of need, so that the poorest of the poor communities can access world-class diagnostics for over 40 diseases at their doorsteps or closer to their homes and communities. And this is already happening in over 90 countries globally. Really, really impressive. So we welcome Sriram. Congrats on the Cochrane Prize. Thank you for making the Global South proud yet again. And we welcome you to say a few words as a guest of honor and tell us who has won the first prize in the India AMR Media Awards.
Thank you, Sadian. Thanks for the nice words. And thank you for inviting me to be the guest of honor. So a lot has been said already about antimicrobial resistance and how it's impacting lives. Clearly, AMR has become a global threat. And unfortunately, thousands of lives are lost for this, whether it's for TB resistance or any other microbial drug resistance. It is a serious threat, not only for developing countries, but it's also becoming an important threat for global Western developed markets, countries. And so if not checked, it can become a global crisis. So I think it's an appropriate time that we are all getting together to address this issue. And also that all stakeholders have to be involved. So it's not just the problem of the medical community. It's also the problem of creating awareness, making people understand, and also spreading the reason, cause, and how you can avoid AMR in future. And so I think I'm so happy to see the media playing a good role here already. And I think working along with the media, the industry, and the public health agencies, including the various government agencies, all have to make a concerted effort to make sure that we're able to tackle this problem so that it doesn't spiral into a major crisis. So with this words, I just want to go ahead and start announcing the first prize. So the first prize in India goes to Ms. Athira Elsa Johnson of the Hindu newspaper. Congratulations, Athira.
Absolutely, congratulations. And friends, Athira reports on health for the Hindu newspaper in India. Having lived through TB and drug-resistant TB, she understands firsthand what illness can do to people. Power to your pen and keyboard, Athira. Please keep making a difference. Wonderful. Sriram, please tell us who won the second prize in India.
The second prize in India goes to Sanket Jain, independent journalist who writes for Yale Climate Connections. Congratulations, Sanket.
Wonderful. And Sanket is an award-winning independent science journalist and documentary photographer based in Maharashtra, India. And now it's time to hear from Sriram, who won the third prize.
The third prize in India goes to Ms. Lata Mishra, Senior Assistant Editor of the Times of India in Mumbai. Congratulations, Lata.
Wonderful. Congratulations, Lata. And friends, we also have 3 special mentions in the India AMR Media Awards. These are Niraj Kumar of Down to Earth or Center for Science and Environment, Miss Udbavi Balakrishna for her article published in the Deccan Herald And third, Ms. Snena Richaria of the Tribune newspaper. Congratulations all. Thanks so much, Sriram. Keep inspiring and best wishes. And congratulations to all the awardees of the India AMR Media Awards today. And also to each of the 106 journalists who applied. The real prize is the impact your stories are making in changing the public health narrative toward equity, rights, and justice. And now for closing remarks, I'm going to hand over once again to Shobha.
Thank you, Cedrian. Thank you very much for being with us today to grace the occasion. Super grateful for finding time for this activity. Thank you very much.
Sure.
Thank you. I now invite Dr. Tim France to give his keynote lightning talk. And then we will have some reflections from some GAMA leaders from Asia Pacific and African nations. Dr. France is a molecular biologist turned a noted global health thought leader and founder and MD of Innis Communications, an honorary advisor to CNS and GAMA. I would also like to mention here that Tim founded and led a global key correspondence team at the peak of HIV epidemic 30 years ago. Over to you, Tim.
Thank you, Shobha. Thanks for the introduction. And hello, everyone, and welcome. I'm delighted to open this final discussion session of the forum today, particularly as we approach next week's AMR Awareness Week. Many thanks for the invitation. And I also get to go first to congratulate all the award winners today. So well done to everybody and to GAMA for organizing the awards a second time. It's wonderful to see such a dedicated group gathered here. Not just technical experts, but also journalists and communicators who help shape how this story reaches the wider world. So briefly, just to kick off, let's start with the reality. I mean, the latest AMR surveillance report paints a sobering picture, as we've been hearing today, and AMR remains firmly among the top global health threats, undermining the foundation of modern medicine. First, the scale of resistance is growing. Roughly 1 in 6 bacterial infections worldwide is caused by pathogens resistant to antibiotics. Second, the threat to critical care is real, and resistance is particularly severe among gram-negative bacteria, the very pathogens most associated with hospital infections and higher fatality rates. And third, this burden is profoundly inequitable. So low and middle income countries where health systems are often weaker face the highest resistance levels. But let's focus on what we should be encouraged by, because amid these challenges, there is real progress and momentum that we can and should be talking about. So a few points I would highlight is that surveillance coverage and data quality have expanded dramatically, and the GLASS network now includes 104 countries, covering more than 70% of the global population. And since 2016, that's a 4-fold increase, which is really good news. Political commitment is stronger than ever. And I think it's interesting to think of this as, for the first time, global surveillance data is itself now being used as a policy compass, not just as a warning system. And that's not the case in all areas of global health. We shouldn't take that for granted. That's a real win. And also there are some really tangible regional success stories emerging. So for example, MRSA rates have declined steadily in several regions by something like over 7% annually in Europe, 6% in Southeast Asia, and so on. So focused interventions really do work. And if we turn to the R&D front, there's also both encouraging signs and some serious concerns. The good news is that the 2025 antibacterial pipeline report shows there is really active monitoring and coordination happening. And again, we shouldn't take that for granted. R&D is being tracked systematically, and there's high-level recognition of the pipeline problem, that in inverted commas, that's now unmistakable. And there are also clear target product profiles being prepared and shared for guiding development. And importantly, as we just heard, this focus extends to diagnostics. So the WHO AMR Diagnostic Initiative and related roadmaps are accelerating faster, more accessible and more affordable testing tools, particularly for low resource settings. But we must keep perspective. All of these pipelines remain fragile and still, and I quote, are unlikely to deliver effective alternatives in the near future for several of the critical BPPL pathogens. But I would kind of, and I'm not known for having necessarily an optimistic outlook, but my takeaway is positive, and it's that with AMR, we now know precisely where the gaps are, and those gaps are being monitored, prioritized, and quantified. And this is a vital step towards global accountability and action. And to me, that's our genuinely positive news from all of our discussion about AMR. So to kind of frame the discussion, we find ourselves at a kind of a pivotal moment. The threat is clear, but so is the direction of progress. Better surveillance, stronger commitment, expanding diagnostic innovation, and growing recognition of the urgent need to invest in new antimicrobials. The question for us today, and particularly for those involved in communication, is how can we help to keep that momentum? How can we tell engaging stories about what can be complex realities to clearly and accurately convey this momentum to the wider world? And with that, I'd like to open the discussion, to open the floor. Let me ask, given the challenges and the progress we've outlined today, what developments make you most hopeful that we can meet the 2030 AMR targets, even in what we know is a constrained funding environment? And how can stories about this momentum be told to drive public engagement? Can we use positive stories to drive public engagement? Thanks very much, Shobha. Back over to you. And I think to anybody who wants to add their point. Thank you.
Thank you, Tim. Thank you very much. And now I invite some of the GAMA leaders from Asia, Pacific, and African nations to please speak and address Tim's concerns. I think we will begin with Oreluwa Macaulay from Nigeria with a poem. Over to you.
All right, thank you very much. Such a privilege to be here. So I'm going to share just a 60-second excerpt from my poem, and it goes thus.
Yes, thank you.
A 19-year-old cancer survivor loses her life to the candida fungi. Painful and drug-resistant E. coli infection tears a man's life apart and renders him homeless when he can no longer work and fend for himself. Retreating and rebounding flesh-eating bacteria leads to septic shock and the death of a young doctor. This silent pandemic is causing loud loss, and we can no longer afford to be unbothered, ignorant, nor quiet. Antimicrobial resistance is urgent, and it is real. And here's why. These germs evolve, adapt, and defy, while old defenses fade and die. These microbes grow, and now they're stronger, while antimicrobials have become weaker. Now whispers of warning rise through the year. Resistance is growing, the world should hear. A pill, once simple, a shot, once sure, now falters, uncertain. Can it still cure? Thank you very much.
Thank you, Oreluwa. Athira, would you like to say something?
Hi. Thank you for having me, Shobha. Hi, everyone. First of all, I'm really grateful for this platform and for the collective effort to continue conversations and documentation around antimicrobial resistance. I'm also a survivor of tuberculosis and drug-resistant tuberculosis from 2015 to 2021, meaning I have lived through daily injectables, heavy medication, and isolation and stigma that followed too. So spaces like this actually feel very, very special, very important. And the story I reported, which was being recognized today, that is on looking at the rise of antimicrobial resistance in sexually transmitted infections and the gaps we still see in testing, treatment access, and stigma-free care. Documenting stories like this to bring them into political and public attention in a newsroom means pitching, refining, defending, and answering many why this and why now along the way. So to have a newsroom, especially like the one that I'm working with, the Hindu's health team, that understands the urgency and backs you through the process, makes all the difference. I take this opportunity to thank my editor and editors and colleagues, especially Ramya Kannan and Subeda Hamid, for that kind of space and trust. Surviving drug resistance in India, it leaves you with a lot to navigate, especially disappointment, anger, and grief. So I'm grateful to my colleagues and platforms like this that help channel those into work that matters. And to say this clearly, when we talk about AMR, of course, we must talk about prevention, but also aftercare, the disabilities and chronic conditions that follow treatment, and the need for a framework of justice for those who live through it. Centering lived experience in healthcare policy and reporting to is part of how we move towards that. That's all I want to put out today. Thank you so much for having me. I look forward to more dialogue, more listening, and more documentation. Thank you so much.
Thank you, Athira. Thank you. Keep your pen going and moving. Yes. Yes, Vanessa. Sorry. Yes.
Yeah, thank you so much. So I think that one thing I just want to say quickly is, as a patient, we want to know that there's hope. And I think that that's what we must be careful of. We saw during the COVID pandemic that, the type of media, the type of information that went out was kind of, at some instances, was fear-mongering.
Yes.
It created fear in people's hearts. And if you feel that there's fear, if you feel that there's no hope, you don't think that you can do anything. And I think that some people, in terms of behavior, react to that. They get angry. They get angry with science. They get angry, and so I think the ultimate thing is to say that this is an evolving problem. It impacts all of healthcare systems. It impacts all medical conditions. But there's something that we can do. I think that's really important. We know that millions of people are dying from it, and so we need to bring that reality to light. But I think at the same time we need to be talking about what we should be doing. So in other words, using antibiotics, antimicrobial medicines responsibly to protect them. And then, of course, looking at other alternatives. So, novel therapies and so on. So I think let's just be very, very careful. Don't fearmonger. Don't create this antibiotic apocalypse. Make patients and people feel like they have a role to play before they feel like, we don't want to take antibiotics for anything, because antibiotics do save you when you need them. And we need to keep that culture in our minds to say, well, I still need these, but only for the right circumstances. And that's, I think, the main message that we need to be bringing across, even with using our stories.
Thank you, Vanessa, and very rightly said. No fear mongering, and giving out the right message, science-based, evidence-based messages also. Because you talked of COVID, and there was a lot of use of antibiotics unnecessarily during COVID times when they did not help at all. In fact, they must have fueled AMR. But there were so many, I heard so many people using antibiotics because they did not have the correct information also. So you are very right in that. Giving out the correct information and no fear mongering. Definitely. There has to be hope everywhere. Thank you very much, Vanessa. Yes, Bhakti? Yes, Bhakti. Yes.
So first of all, I would like to thank you for arranging this Global Media Award, and congratulations to all awardees. I think AMR nowadays is a big issue, and it's good that we are covering it. I survived drug-resistant tuberculosis in 2017 when nobody talking, seriously about the AMR. And without any previous history of TB, I diagnosed with extensive drug-resistant tuberculosis. So I would like to, add here only two key points, that how this media coverage about this AMR or the health issues are important. So when I was diagnosed with the drug-resistant tuberculosis, first I went to the family doctor who prescribed me with the preliminary antibiotics, which was not working on me. And with some preliminary diagnosis testing, I was put on the first line of treatment. But my father, who read the newspaper daily and who aware about this drug resistance strain and all, we thought of taking a second opinion. And when we went to the specialist doctor, then we conducted some advanced testing like DST and all, and my diagnosis was very quick. Within a 1 month I put on the right drug with the DST testing. Also the media channels who covers the survivor story, that helped me to get into touch with those survivors who whom with I connected on the social media. I shared my experience, they shared their experience, and which helped me to complete the 2 years toxic treatment. So I think media who covers such survivor story about the new diagnosis, about the access to the medicines, this I think it's important nowadays to cover. And if we continue with that, I think we definitely help to tackle the AMR issue. It's very important that, because normal people, common people, who they are not aware about these issues. Scientific people, scientists, doctors, healthcare workers, they are aware, but I think we need to share our stories to maximum people, and to create awareness is very important to tackle the AMR.
Thank you. Thank you, Bhakti. Audrey Galavu from Zimbabwe, are you there? Audrey?
Yes, hello.
Yes, hello. Yes.
Can you hear me?
Yes, we can hear you. Yes.
Okay, I just wanted to say thank you, and I'm honored to be joining all of you. So what I want to say is that we do have a lot of challenges in the fight against AMR, but despite all the challenges and despite all the financial gaps that we are all aware of, I believe that there is still a lot to be optimistic about when it comes to the fight against AMR. Especially when we focus on getting the fundamentals right. If we ensure that people are diagnosed early and accurately, we prevent the misuse of antibiotics from the start. And when we make sure that patients are linked to the correct treatment and supported throughout their treatment, we reduce the chances of incomplete treatment that fuels resistance. And also, as someone from the media, I think it's important, it has been said before, I think it's important that we take out AMR from the technical spaces into lived realities, because what I noticed is that when you say antimicrobial resistance, people think it's something that is out of this world, but it's a lived reality. It's happening every day in our communities. So as the media people, I think it's important that we take AMR out of the technical spaces, so that policymakers, communities, and other change makers can also feel ownership of the solutions that we bring out as the media people. So I am optimistic because we know what we have to do, we know what works, and if we focus on our efforts on doing those basics and fundamentals and doing them right together, I believe that we can make real progress in the fight against AMR. Thank you very much.
Thank you very much. Abigail Tembo from Zimbabwe, are you there? I don't think so. Babakar from Senegal. Yes, Babakar. Babakar, would you like to speak?
Allô?
Yes, hello.
Allô?
Yes.
Oui, je suis Babacar Sen. Donc, je
Yes.
remercie les gars, Dr. Tim, qui m'a relancé un peu pour cet excellent discours qu'il a vu sur la session 4. Et je peux te remercier tous et toutes pour cette dernière session 2025 et congratuler tout le monde et formuler à tous et à toutes mes meilleurs vœux de fin d'année et d'anticiper sur le nouvel an 2026 pour de meilleures conquêtes réussies. Vous m'entendez? Est-ce que vous m'entendez?
Can you speak in
que
English, Babakar? Can you please speak in English so that we can understand? Is it possible?
Okay, yes, it's possible to speak English. To thanks
Yes.
for all. Également, I want just to link everyone for this last 2025 session and extend my best wishes to all for the end of the year while looking forward 2026, a year of new achievement and great success.
Okay.
I want to share with you linking antimicrobial resistance to food and agriculture is essential. Linking antimicrobial resistance AMR to food and agriculture is crucial to understand the scale of the phenomenon and providing sustainable solution. AMR is not limited to the field of human health, is closely connected to our food and agriculture system, where an excessive or an animal production contributed to the emergence of resistant strains. Connecting this section of therefore key to an integrated approach to prevention and control. Integrating this issue in antimicrobial resistance in agriculture and food policies is indispensable. One else approach recognizing the interconnection between human, animal, and environment and health. I want to strengthen everyone to three things: to our engagement, from journalists to reinforce and leadership of journalists, and congratulate Mr. Makara Hack, and également congratulations for the laureate with the prize of the laureate of the game to speak today.
Thank you. Thank you very much.
Everyone, thank you.
Yeah.
My English is broken. I'm of French, but I'm trying to speak English to understand.
No, we could understand. Thank you.
Thank you, Babakar. And special thanks, Babakar, for organizing agriculture and journalists who report on food and agriculture in Western and Eastern African countries, in especially in French language, to report on issues like AMR. You've really played an important role, Babakar. Thank you.
Yes. Thank you. Thank you.
Thank you. We also have with us Kalpana Acharya from Nepal. Kalpana, over to you.
Thank you, Shobha.
Yes.
Am I audible?
Yes, very audible.
Thank you, Shobha, and thank you, everyone. Namaste. We all know that antimicrobial resistance is a serious public health concern, not only for one country, but for all of us. Despite the many challenges and funding gaps, I believe we can still move forward if we focus on getting the basic rights. Talking about the Nepal, antibiotic misuse and poor infection control are still common. But in other part, awareness is growing and media has a very important role in this journey. Through storytelling, we can make complex science simple. I believe in that. We can raise awareness among the public, encourage responsible use of antibiotics, and hold health system accountable for infection control. I'm very much optimistic and positive because journalists are now more engaged in reporting AMR as part of the health and development agenda. Recognizing journalist effort through Global AMR Media Awards highlights that communication and awareness are essential tools to prevent AMR. So lastly, I would like to share, Shobha, good news here. The Global
Yes.
AMR Media Award Nepal chapter will be held on 24th November in collaboration with the WHO Nepal and Ministry of Health and Population, along with Health Journalist Forum Nepal.
Very
So
good.
we are going
Great.
to organize that program.
Yes.
With this, I would like to stop here. Congratulations, all my media professionals, for this wonderful award. Thank you, and thank you all.
Okay, thank you, Kalpana, and great news. All force to you. All force to
Thank
you
you so
for
much.
carrying forward. Yes, thank you. Doc Thieu from Myanmar. Dr. Tin Mong Thieu from Myanmar. Are you there, sir?
Yeah,
Yes, we
I'm
can hear.
here.
Yes.
Minglaba to you all. That is good evening from Myanmar. And talking about the Myanmar context of the AMR, actually AMR containment programs are started since 2017 when Ministry of Health published National Action Plan on AMR 2017 to 2022. But in this, the many objectives in this plan. One of the most important and the first aim is to raise the awareness of about the knowledge of AMR through the also not only public but also the medical professional. They will disseminate the knowledge of the AMR in medical professional and through the general practitioners and all other related health-related institutions. And actually, as you all know, since 2021, our country's condition is not a good, not a stable condition due to the political conflicts and other armed conflicts and also humanitarian crisis. Most of the activities are limited. In concern with the media, most of Myanmar journalists and Myanmar media are limited, and also human resources are also lack. Most of them are emphasized on the political issues. So health issues are not much published or not much printed in media or not broadcast in the broadcasting media. In Myanmar, according to this survey, there is only 26% of information that people from media only. That is, we need to raise our work, our journalist work to increase to disseminate the knowledge of AMR. So we have many challenges like lack of resources, lack of budget, lack of any other challenges. We need to raise through the like training of our Myanmar journalists about the AMR and more activity to distribute all the media. Yeah.
Thank you very much. But we have people like you still in Myanmar to carry on the fight. Thank you very much. Hamu Madzedza from Zimbabwe.
Hello.
Hello, Hamu. Yes.
Hello.
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 Yes, we can hear you, Hamu.
Can you hear me?
Yes, we can.
Can you hear me?
Yes, we can hear you. Please proceed.
Good day, everyone. As a member of GAMA and external advisor for the External Advisory Board for the AMR Narrative Org, I'm humbled to be one of the Global AMR awardees for the second time. I'm proud to have played a part in shaping conversations around antimicrobial resistance. It's been a journey of growth, learning, and collaboration. And I'm thrilled to be flying my country's flag, Zimbabwe, on the global arena. And great thanks to my executive director for the AMR Narrative Org, Vanessa Carter, she has been one person who has trusted me with even sharing her life story with me, and also helping me out with various issues on AMR. And also, I would like to thank the GAMA team, and especially Shobha. She has believed in me, considering that AMR is a complex issue. And for us as health journalists, it's a bit tricky to cover that issue. But with the help of GAMA and with people like my executive director, Vanessa Carter, it has been an easy journey. And also, I believe as a health journalist, I'll continue to play my role in terms of educating, informing, and entertaining the globe in terms of the issues of AMR, and also helping them to understand the dangers of misuse and inappropriate use of antimicrobial resistance. Because in terms of our pipeline, or in terms of antibiotics, it's a bit now drained, and we cannot derail the gains that we had achieved in terms of having antibiotics in our bag. And also, I would like to thank all, even our judges, for just believing in me, because being amongst the top, if I'm going to say 10 in Africa, when you have such covered in like AMR, it's something to give myself a pam-pam. And thanks to the global, and thanks to GAMA, Shobha, for just birthing such an initiative like the GAMA, so that at least us as journalists, we can also play our role in terms of addressing issues of antimicrobial resistance. And I would like to say thank you to World Health Organization, Zimbabwe Country Office, for just hosting us and celebrating with us today. Thank you very much.
Thank you. Thank you very much. Thank you, Hamu. Esther Nakazi from Uganda.
Thank you very much, Shobha, and thank you very much, everyone. Oh, I have an echo. Thank you, everyone. It's a great honor to join you today as we recognize and celebrate the outstanding journalists and storytellers who have helped bring AMR to the public attention. AMR is one of the biggest health threats of our time. It affects everyone, everywhere, from our hospitals to our farms, from newborns to the elderly. That is why we need to work very hard as journalists to bring it to the table. Journalists are the bridge between science and society, helping communities understand what AMR is, why it matters, and how behavior, policy, and practice must change to protect the medicines that protect us. Today, we celebrate not only the winners, but every journalist who has chosen to report on AMR. Your stories give voice to health workers, patients, farmers, and scientists, and inspire governments and the public to act. To our winners, congratulations. Your work stands out for the depth and clarity and courage. And as we look ahead, I encourage all members of the media to continue covering AMR consistently, creatively, and with urgency. Let's make it a household conversation, not a distant scientific issue, because AMR is just not a medical problem. It is an economic and a development challenge, and we all have a role to play. Thank you very much.
Thank you, Esther. Thank you very much. Shiochin from Malaysia. Shiochin Tan.
Thank you, Shobha. A very good day and evening to everyone. Apologies that my camera is not working well.
Okay.
So I was thinking about this from the point of view of, if I'm just a regular member of the community, I've got no money, what can I do to help fight AMR? So I have two thoughts. The first one is very basic. Some might think it's too simple, but just don't get sick. Right? Let's remember the lessons from COVID-19. Let's wash our hands regularly with soap and water, wear a face mask if you're sick, or if anyone around you is sick, boil your water, wash and cook your food properly, get your vaccines if you can afford it, or if your government gives it for free to you. Speak up if you see someone abusing antibiotics. If it's your friend or family, just tell them, hey, this is not really the right way to go. And Of course, eat a healthy diet and drink lots of water and do physical activity for your good immune system. And do not simply throw away your medicines into the rubbish bin, because that also can help fuel antimicrobial resistance. Make sure you get rid of it in a proper manner. The second thing that I was thinking of, as a member of the community, please lobby your local politicians to fight for antibiotic control. In Malaysia, antibiotics are a prescription medicine which you can only get from a doctor, but I know that in many of our countries here that you can easily buy antibiotics over the counter. So, try and lobby, ask your politicians to lobby for a law in order that antibiotics can be more strictly controlled. And lastly, if you're familiar with any philanthropists or, rich people who have extra money, why don't you ask them to think about contributing to AMR? They can contribute to the AMR Multi-Partner Trust Fund and, get a bit more funding to the cause. And that's all. Thank you very much, everybody.
Thank you, Shojin, and points well taken. Very, very valid and relevant points well taken. Yes. Munyaradzi Blessing Doma from Zimbabwe. Munyaradzi.
Okay, thank you.
Yes.
Yeah, can you hear me?
Yes, very well.
Okay. Thank you so much to all the judges for actually recognizing my work to be amongst the best. It actually means a lot, because sometimes as journalists you just write, but then for you to be awarded in such a manner, it means a lot. It means a lot, so we really appreciate that. One thing that I can also add is when the World AMR Awareness Week happened in Zimbabwe, I think in 2023, that's when I got my eyes opened to the issue of AMR, and I just then hit the ground running, and I was so excited to share my work with what's happening in Zimbabwe. And I'm happy to say that as a journalist, I will continue to work so that we really highlight, because we've seen that in most cases, people are actually not aware of all these challenges that happen with AMR. So I'll do my part to keep on raising the awareness, and also to thank the GAMA team. It's so good to be part of this noble cause to raise this issue, because going into the streets of Harare trying to highlight all these issues, you notice that many people are not even aware that they are actually doing things that are not good for their health. Like you see people easily taking antibiotics, even for a simple ailment like flu. So to have to play my part to raise the dangers of AMR, it really means a lot. And just to say, just like what I think Emmanuel spoke, AMR is a complex issue, so please, whenever you can, all the scientists, they should keep on helping us with more information so that we write on all aspects of this subject. And just to thank everyone and to say all the best to all the people who continue to work so that we can prevent AMR. Thank you so much, Shobha.
Thank you very much. And Mokatam Madhubabu from India. He's one of our stalwart writers on AMR. Mokatam Madhubabu, are you there? Is he there or has he left?
No, I think he has left.
He has left. Okay. Pooja Mishra. Pooja, we want to hear you.
Yes, ma'am. Thank you so much, ma'am. Actually, sorry for the late, but finally I reached
Yes.
seated at home. So, firstly, ma'am, thank you so much for this opportunity, and while be nominated for this award, and thank you so much. Yes, we have a lot of challenges in MR, but we need to come on the solution part.
Yes.
Just I want to say about the YLB team. In our network, we have 800 people, youth living with HIV, widely suppressed. So this is the outcome actually, and we should take in at the edge in MR also. We take the continuation medicine, regular on timely medicine. So that is our comments. So not just take medicine from anyone. Without prescription, we should not take the medicine from anyone. And as a social media influencer, today today I committed for the sensitization awareness from the social media and our youth. Thank you so much, ma'am.
Thank you. Thank you very much. And thank you to all those who have stayed with us till the end. And it has been, I hope it has been an enriching session for all of us. And we continue with the simple methods and perhaps whatever is in our hands to battle AMR. A lot of it is in our hands. So at least use that. And of course, the role of media has been amplified, and let media keep on making this rather very technical issue at times simple and easy to understand. Thank you very much, and stay healthy and protect yourself so by protecting the medicines which protect us. Thank you very much.